In today's video, we will look at a case where a patient sustained foot drop caused by lumbar disc rupture and have been persevering long-term rehabilitation. The patient developed right foot drop around October 2023 as a result of an L5-S1 disc herniation. He underwent discectomy, but the condition persisted for approximately 10 months. He presented to our clinic on August 3rd, 2024.
왼쪽 한번 올려보세요.
Muscle strength examination shows normal dorsiflexion strength in the left ankle, but significantly reduced in the right. In the sitting position, he can only slightly lift up. This time, the patient is assessed to see if he can lift the forefoot off the floor in a standing position. The right forefoot does not lift off the floor. This is an ultrasound image of the tibialis anterior muscle, which is responsible for dorsiflexing the ankle. Compared to the left, the right tibialis anterior muscle shows reduced muscle mass. Treatment involved injection therapy targeting the weakened muscles and the nerves that innervate the muscles, using a solution containing 5% dextrose and nutritional components. In addition, injection therapy and electrical stimulation were performed for the lumbar plexus. You can see the leg moving in response to the nerve stimulation. Although treatment was initiated, the patient's symptoms showed little improvement for 4 months. In my experience treating patients with paralysis, they often experience depression caused by the despair of not being able to move their limbs and the sense of isolation that comes from a significant loss of social participation. Furthermore, if the paralyzed area is directly related to the patient's occupation, the resulting depression tends to be more severe. After nerve injury, regeneration is known to occur slowly at a rate of about 1 to 3 millimeters per day. Therefore, in cases of paralysis caused by spinal conditions, a long-term rehabilitation plan may be necessary, often extending beyond 1 year and sometimes lasting 2 to 3 years depending on the severity of patient's condition. However, even in such situations, if the patient continues rehabilitation with patience, meaningful recovery can eventually be achieved. Today's patient showed little improvement for 4 months after starting treatment, but a slight yet meaningful change in muscle strength appeared around January 2025.
자, 그 상태에서 발목에 힘 완전히 빼보고요. 힘 뺀 상태에서 발목 위로 올려볼까요? 힘껏 위로, 더 힘껏.
You can see that the patient's ankle dorsiflexion strength has improved. 자, 발 앞부분을 들어보세요. 힘껏! The right forefoot begins to lift off the floor. This clip shows electrical stimulation therapy being applied to the patient's low back. In cases of foot drop caused by spinal pathology, it is important to directly stimulate the spinal nerves. This is an ultrasound image from April 26, 2025, about 3 months later. Treatment was applied to the weakened muscles in the leg and the peripheral nerves that innervate them.
그 상태에서 발목 위로 힘껏 쭉 당겨보세요.
Compared to the first visit, the ankle shows greater movement.
발목 위로 올려볼까요? 힘껏.
In the sitting position, the angle of ankle dorsiflexion against gravity has increased.
네, 됐습니다. 자, 발 뗀 상태로.
Now, he is able to maintain the forefoot in a lifted position. Even though the change is only a few centimeters, it represents a meaningful result born from the patient's sincere perseverance. This is the patient's gait analysis.
됐습니다.
There is no visible foot dragging or exaggerated knee flexion typically seen in severe foot drop. However, the gait is still not natural due to incomplete dorsiflexion.
됐습니다. 다시 이쪽으로 와보시고요.
The patient is currently about halfway toward the treatment goal. Through purposeful repetition, he continues rehabilitation, each effort becoming not mere recurrence but a step toward creating a more meaningful difference than what has been achieved so far.